Today's conversation on Dr. Geo podcast is with Jeff Young, who is a kinesiologist and certified strength and conditioning specialist who implements and oversees medical fitness and post-rehab patient services here in New York City. Jeff is a president-elect of the American College of Sports Medicine, Greater New York Regional Chapter. Jeff is an expert and he loves to talk shop on fitness and strength training. He is a scientific geek with that, except that he's willing and able to talk to the normal person and make things understandable in this conversation. We talk about everything strength training and what kind of physical exercise is important. And we have a little debate as to really which one is number one, barbell squats or deadlifts. Tune in to find out which one is Jeff's number one versus my number one in this podcast. Today's conversation with Jeff Young on strength training and physical exercise. Let's go. Welcome to the Dr. Geo podcast. I am your host, Dr. Geo, where it is my goal to help you with your urological function and live better with age. Today, we have an interview with Jeff Young. We're going to talk about exercise medicine. And Jeff, welcome, first of all, to the podcast on the middle of a holiday week. I appreciate you coming on. Thank you so much.
Absolutely. Yeah. Thanks for having me. And, as we've talked about before, we love talking shop with each other. So
That's
I just
right.
look at this as an opportunity to talk shop. So I appreciate
That's right.
it.
Jeff, I have to ask you, man, the first question that comes to my mind. Did you change your last name since you're now into the exercise longevity, anti-aging thing? And is Young your real last name?
Man. You got me.
Well, come on. It can't be more perfect than actually I know a female physician who got into anti-aging. Her last name was not Young, but she married into a Young. And I was like, did you do that do you actually love this guy, or do you just want his last name so that you could, promote yourself?
Get this, at my first job out of college, at Duke Medical Center, one of the people on staff, one of the exercise physiologists, their last name was Patella, Patella, and,
right.
and one of our nutritionists' last name was Fry. I just got kind of lucky. Maybe I was made to do this, and
exactly
and right. So,
look, I know a urologist whose last name is Wiener.
No way.
Yeah, sure. So Patella is the knee bone for those in the audience that are kind of lost what that's about. So I think that 99% of what's out in social media, it's crap, and is there to separate people and to keep people more pissed off at each other.
Agreed.
And so forth. So a lot of it is negative.
Yes.
I certainly can see what it does to teenage girls because I have teenage daughters, right? So most of it is negative by far. But I engage because I think, why rather than sit there and kind of talk about it and be upset about it, why don't you do something different? So I try to put out there positive things. And a few people keep me in because a few people give out some really good information, latest scientific findings, and you break it down. You're one of them, man. You're one of them. Your Facebook postings, and you can share your links with anyone on your Facebook names and so forth at any point. You're one of them. You give a very good. You highlighted great studies on. I see it on Facebook. I don't know if it's anywhere else. And then you break it down very nicely so that the user, typically, it seems like you write a lot to practitioners, can utilize it and help their patients. So, I appreciate that because people like you keep me in, and I keep just searching for your work and other high-level people's work. Yeah, the other thing is, I'm just thinking out loud here, the way you talk about physical exercise and strength training is like I see, my wife and I she every now and then she catch me watching ESPN, these reporters, right? These sports reporters. And she says, these people, they talk about sports like there's nothing more important in the world than the sport, with such passion.
Yeah.
And so I think of you as that, as it relates to physical. You talk about it like there's absolutely nothing more important than physical exercise and strength training.
I appreciate it.
So tell us about how did that evolve to what it is now, and what's your background with it?
Yeah. Okay. So I've had I'm in my 27th year, so I've had a long and windy and very unique career.
So you're 27 years old, Jeff? See, you are Jeff Young.
I started when I was 0. And I'm now 27.
I always tell people, shave your head. If when in doubt, shave your head. You'll look younger.
That's hilarious. Yeah, so I've had a long and windy, and I'm aware it's been a very unique career. And so I'll just kind of give you the outline version and jump to through different parts of it as it relates to this podcast and what we're going to be talking about. But I got to go back to I graduated from Penn State in '96 with a degree in what's called kinesiology or exercise science. And I have to start there because I was right place, right time in the sense that I got involved in what at the time was the longest strength and conditioning study that had ever been performed. But more importantly, it was under the direction of someone named Dr. Bill Kramer, who is widely considered the premier strength and conditioning researcher in the world. And then, as importantly, unlike just being a study like comparing squats and deadlifts or muscle activation or something like that, this was a very long and unique study on how to design optimal programs. So here I am, I get to start my career with, being in this scientific and controlled study under the direction of the premier strength and conditioning researcher in the world, learning how, basically piggybacking off what I'm learning in class on how to design optimal programs. And I don't have time to get into the whole study, but I do want to just quickly mention that there was like an aerobic training group. There was a calisthenics group. There was a group that trained in the higher repetition ranges with lighter weights, like that 15 to 25 repetition range. There was a group that trained in the middle repetition ranges, the 8 to 12. And then there was what they called the power group. And that's the group I was involved in, that trained in lower repetitions with heavier weights. And so maybe we can talk a little bit.
So break that down, because actually I do want to get into that study a little bit, if that's okay, because I think
sure.
I think it's actually crucial so that we understand. I never want to leave the audience high and dry, and here's the study and sound smart, but I do want to be evidence-based, science-based, right?
Sure.
So this is not just things that I come out of the air. Everything I say, we talk about in interviews like this. So there's 5 arms in this study, it sounds like. How many were in how many participants were studied, and for how long, and what was the outcome?
Yeah. So basically what happened was the United States Army came to Dr. Kramer and said, perform a study on women between the ages of 18 and 32. And let me interject and say, it really, in the end, it wouldn't have mattered if it was women or men.
I see.
Any
idea why women and not just men and women?
Yes, because they wanted to see if women could make enough strength and conditioning gains to justify their position in combat roles. And I had just gotten out of the Army, so this is part of the reason why I was very intrigued and wanted to get involved.
Yeah.
So that was the purpose of the study. And so they actually had 2 control groups. One was men who did not go to the gym, because at the end of the study, they wanted to compare the outcomes to your average male who is not a gym goer.
I see.
And then they had a control group that did nothing. And then, like I said, they had an aerobics group, a calisthenics group, a higher reps and light weight group, a moderate reps and moderate weight group, and a low rep and heavyweight group that they called the power group.
And the control group, just so that they're just ordinary men.
Men and ordinary women. So there was 2 control groups. They wanted to compare it to women who are untrained and don't, healthy, your average healthy woman who's not trained, who's not go to the gym and work out, and not on a structured exercise program, and men who, with the same description.
So we're trying to see, all right, what form of exercise, if any, is better than the other relative to those that men and women that don't exercise and are not trained. So whether it's aerobic, whether it's high reps, low reps, we're trying to figure that out.
Yeah. So do you want me?
How long was the study? What was the outcome?
So the study actually lasted over the course of 3 years, but it was like in 6 months sections. So they'd have a cohort, like for instance, the cohort I trained for 6 months. It was like 3 months where they, if you want to get into some of the more details a little bit later, when we talk more about this prescription, or I can do it right now. It's really up to you.
Well, let's talk about how long was the study? About 3 years. What was the outcome? And then we'll break that down as we talk about other aspects of exercise medicine.
Yep. So to jump to the conclusion, the group that I was in significantly outperformed every other group. Like, they did very thorough Army style testing, push-ups, sit-ups, runs with a 72-pound rucksack on their back. They did bench press and squats and Olympic lifts and all that. So it was very thorough testing. And the group that got the strongest, which was the group that I trained, the group that I was involved in training.
So Jeff, you were a participant. You were one of the study members.
I was involved in all aspects of training and testing. So I was a trainer. I was a student trainer.
Excellent.
And the subjects were women between the ages of 18 and 32. And it was amazing to watch basically what I was learning in class, which is basically how to structure a strength training program in action. And then amazing to see in such a short period of time their strength and performance increases, and then their attitude changes along with it. How, like, at first they were, they didn't like that they were randomly thrown in the power group because they were worried about bulking up and, a lot of that kind of stuff.
Yeah, things that don't necessarily.
And then sure enough,
that is hilarious, by the way. People who don't want to strength train because they don't want to get too bulky, as if it's that easy to get that bulky.
Exactly. Exactly. So but it was just really cool to see, like, everything, not only their strength and performance gains, but their change in attitude as they went through it. And the fact that so here I was involved in the study where I also was involved with training the group that significantly outperformed every other group. And so.
So what group outperformed the other? Or did they all do well?
No, they all did well.
What was the endpoint that we're looking at?
Yeah, so the endpoint that we're looking at, like if we had the study here in front of us and we were reading the conclusion of the study, and it's a very long paper and a bunch of conclusions, but the gist of the conclusions were that no, women don't bulk up, and that from a lower body standpoint, they can actually make significant gains on men in strength and performance, and that who
are sedentary,
men who are healthy but aren't on a structured exercise program.
Got it.
But that ultimately, from a program design standpoint, you would want to not, because the body can't handle training heavy all the time. So you would want to set up a program that actually trains across a spectrum of repetition ranges, kind of in a little bit in the higher ones with lighter weights, probably a little bit more time in the moderate repetitions with moderate weights, like that 8 to 12 repetition range, but then absolutely in, dipping down into that 4 to 8, 3 to 8 rep range as well. So from a practical standpoint, it was include aerobic exercise, but make sure you got resistance training. You got to dip down into those lower ranges with heavier weights. And they also added that the addition of a plyometric, or in other words, an explosive program, may further improve power. Let me say one more thing. The title, I don't remember the exact title of the study, but it was something along the lines of optimizing strength, power, and hypertrophy, which just means increasing your muscle. Lean muscle. So it was optimizing strength, power, and hypertrophy in women, or something along those lines. And I'm a huge believer, that when it comes to what you want to optimize in a program, I call it the big four: power, and really that just means for the most part, it means the ability to do things quickly, including catching yourself from falling, or activities of daily living. So improve power, improve strength, improve your lean muscle, and therefore your body composition and conditioning. And so a perfect program would be to have both aerobic and strength training, but in your strength training program, don't be afraid to, progress to where you're eventually lifting with some heavier loads and get, to maximize your strength, or at least move in that direction.
The outcome of that study from, they looked at women from 18 years old to 30 something years old, military women. But there's a lot of takeaways for the rest of us who are not in the military, and for the rest of us who are just looking to age well. So thank you for going over that study. That probably, so did that, going back to you and how you started, did that catapult you to say, I love this, I want more?
That's right. So that's why I started with that, because then my first job out of college was at Duke University Medical Center's Diet and Fitness Center, which is a leading medical weight loss facility. Yep. So these were now people who were obese, morbidly obese, very sedentary, all the musculoskeletal and chronic disease conditions that go along with it. I'm fresh out of college, and the language I speak is this, this study I was involved in. But I knew I was smart enough to know that you have to scale things. I can't be training the sedentary people as hard as we did the subjects in the study. So that was great, because now I was able to base, and that's actually kind of my point, is that yes, what we did in the study doesn't just apply to young, healthy females. It applies across the spectrum. And then flashing forward to later in my career, 2006 to 2016, I was the founding fitness coordinator in a Mount Sinai, Beth Israel facility called the Center for Health and Healing. During my 10 years there, we evolved into the most comprehensive urban-based integrative medicine and medical fitness facility in the United States. This is actually a big reason why I'm talking to you right now, because if it wasn't for that 10 years there, I wouldn't have the skill set that I do. So now I'm applying those things that I learned at Penn State and then Duke to people across the spectrum of medical maladies, disease and 50s, 60s, 70s, 80s. And so what I realized, and my whole point, is that concepts and principles are concepts and principles, and they apply across the lifespan and across the spectrum of medical maladies. You just have to understand how to scale things.
Absolutely. So you've been in the game for a long time. And again, your level of passion is unparalleled, I have to say, or at least anyone. I've spoken to other strength and conditioning coaches, but yours is unparalleled. So that's the reason I said I need to have Jeff on the pod. So here's what we're trying to do today, Jeff. I think that what I'm interested in and what my audience is interested in is, all right, how, very few people. I was having a conversation with a friend who was like, I don't want to work out today. And the next day was the same thing. I'm like, dude, no one wants to ever. I mean, even right, even the meatheads.
That's right.
Don't wake up in the morning and say, I can't wait to go to the gym and start pumping. No one does.
That's right.
Right.
That's right.
So this is one of those things that is not a quick fix. You just don't take a pill. Right. One of these things that give you a lot of bang for your buck. In the study that you mentioned, that you were part of, Penn State, one of the things you mentioned that stood out in my head as you were saying it now is their attitudes change.
Yeah.
Why? Because there's mental health benefits.
That's right.
From physical exercise.
That's
so
right.
If we were to have exercise in a bottle and patent it, you and I would be trillionaires, because it hits so many areas. It has so many medicinal properties, therapeutic properties. I'm nursing left shoulder, whatever, radiating pain down my arm. But it's been the case for, it flares up for whatever reason. I don't know why. It could be from, I do martial arts and things. Here's the bottom line. I train with a few people and say, oh, don't you want to check it out? I say, I might, but we'll see. I take care of all these things with more strength training. Obviously, I have to do things differently, be careful, even more careful with form. And I can't lift as much because I can't lift that arm. It gets better. So not only does it not get worse, I've never had a physical ailment of any kind where exercise made it worse. I'm sure it could happen, and but I've never experienced it. Many of my patients have never reported that. And if not, it gets better. So my thing is, look, as you age, you're going to have some pain. Be fit and strong with pain rather than being weak and debilitated with pain. So our conversation, we're going to talk about, we're going to focus on, exercise as medicine to live longer with optimal functionality as we age. Better with age is one of the main phrases of this podcast. And as it relates to any disease that you want to talk about, whether it's reversal or prevention, diabetes type 2, I think is one that's up your alley. But if you can go into cancer a little bit, that's fine. So take us on this journey. Exercise as medicine. What is it? Is it real? Of course, I'm done with that. I don't need to hear it from you. It is real, but in a more, from your experience, because this is a lot what you do. How is exercise medicine And are we just kind of, is it just smoking mirrors that all of us that are talking about it that way?
Yeah. I learned from Dr. Kramer decades ago that exercise, so we have physical activity. Exercise is under the umbrella of physical activity, and then you can break exercise down into aerobic and resistance training, and then continue to break it down from there. But when I'm talking about just exercise in general, I'm referring to both aerobic and resistance training. I learned from Dr. Kramer decades ago that exercise has a positive effect on pretty much every system in the body, and that's the reason why exercise is medicine. Strength training, resistance training, which is, in my opinion, underappreciated and underutilized.
I agree.
Right. It has a positive effect on more systems in the body than any other form of exercise. And then now recent research, like in the last 5-10 years or so, is talking about the hormone and byproduct release from muscles called myokines, and other organs under an umbrella term called exerkines, which basically just means that when we start exercising, and to me, this is amazing, and it's a beautiful thing. When we start exercising, our organs and our muscles start releasing hormones and other byproducts, and they use it to talk to each other. It's called organ crosstalk, and so the organs, and that's why exercise is medicine, because it causes it signals muscles and the organs to start releasing products that talk to each other, and then ultimately increase the strength and efficiency of whatever that organ's job is. And it's amazing.
That's right. I always say, as you know, Jeff, I do a lot of prostate cancer work, and I always say that, look, cancer hates an exercised body.
Yeah.
Right? They want you to be sedentary and eat potato chips. They want you to sit down, turn on the TV, and just eat potato chips all day, and that's a perfect environment for cancer. When you do the opposite, they hate that, and they really have it creates a hostile micro environment to cancer cells. And we're all creating cancer cells all the time. You are right now, I am as well. It's just, why is certain bodies able to eliminate them and others are not? Exercise is a huge component of that. Look, again, when you look at exercise, there's a good paper, I believe JAMA on, maybe it's not JAMA, but great paper on exercise for cancers, and making these points, talking about these myokines and the anti-cancer benefits of these myokines, these are chemicals produced by muscles when an exercise muscle that, as you said, has crosstalk, has an effect throughout the whole body, not just locally.
Yes.
So forth. But what diseases would you say, look, if you exercise, absolutely you can reverse blah blah blah? What is that in your mind and from your research and experience?
Just about everything.
Yeah.
So I'm very involved, and I think you and I met either through or at least partially related to the American College of Lifestyle Medicine.
Correct. Yeah.
And so even though we're talking about exercise, let me just kind of pull away just for a second and say that I'm just a believer that we need to look at our lifestyle and lifestyle medicine. And even though there's 6 pillars of lifestyle medicine and they're all very important, and so I don't want to make light of pillars, but I just kind of like to, on a totem pole, I like to put eat healthy, exercise, including strength training, sleep and recovery, arguably up near the top. And so I kind of start with that. And, some of my colleagues within the American College of Lifestyle Medicine, we get in these types of conversations all the time. And we talk about, if people would just do those things, I mean, and I know it's easier said than done. But idealistically, if we would just get adequate sleep, eat healthy, hydration, supplements as needed, and exercise and strength training, that would go about 80 to 90%. It almost doesn't matter what the disease is. So, and let me say
prevention of disease,
prevention and reversal, management, control, reversal.
Now, there's a lot of diseases out there. So I definitely, and man, I tell you that I am a wholehearted believer in that. Then I have to kind of tame my biases and my, because I am, we're human beings. I think that I look, all I see from an oncology perspective, all I see is prostate cancer, and I see stage 4 people. Stage 4. I mean, is already outside of the prostate into the bones.
Yeah,
who are still not only alive, because that's not success in my opinion, alive, highly functional, where they're able to do almost everything that they want to do on a daily basis. That's in my mind. That's what success. People ask me, well, what's the success rate of your protocols? Let's define success. That's what it means in my mind.
Yeah.
I have to, brain cancer. There's other cancers where would it make a difference? I don't know. But there's another depression and anxiety, which I have a podcast that came out today actually on that as an end of the year thing, since we see so much mental health issues going on around the world. Mental health and anxiety, depression and anxiety, type 2 diabetes. That's a reversible. Full stop. With exercise and diet, type 2 diabetes is not type 1. Actually, type 1 diabetes is not reversible through just exercise. That's something different. That means that your pancreas is not created beta. There's no beta cells that create this insulin, or it doesn't create enough insulin. That's something else. But type 2 diabetes, reversible. So here's where I like to go, right? So if you put a gun in my head right now and say, Gio, right now, tell me what's the number one thing that can kill me as I get older. Holy shit. I mean, I don't know. Cancer, heart attacks is, Alzheimer's is, I don't know. Gio, one thing. What's the one thing that can lead to almost any disease as I get older? What's your number one concern? I have to say sarcopenia. Sarcopenia is muscle wasting as one gets older. You lose muscle. The body wants to, and what you need to fight is this steady muscle loss as after whatever age. My understanding is even 30 years old. After 30 is just all downhill from there if you're not careful. But it's only muscle wasting. What does it have to do with cancer? What does it have to do? Metabolically, a lot of diseases are metabolic problems where, to keep it simple, what's consumed is not utilized properly for energy. So then that causes other problems that lead to cancer, heart disease, Alzheimer's. So that causes a huge metabolic problem. Not to mention the falls from just weak muscles and no muscles and bones, and those falls that cause fractures. One of the things in the elderly that causes a lot of downhillness, I think I just made that word up actually, downhillness, made it a verb, is fractures. Because then they can't move, and then so they get depressed, and then they move less, and then it's just like one thing leads to the other, and then the heart attack or the stroke or the pneumonia or blah, 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 right? All these things that can be, if not completely prevented, I don't know, maybe you can let me know. At some point, it's still going to happen anyway. I don't know, 110 years old. I don't know what that number is, but the decline will still happen. But, in terms of what gives you the most bang for your buck is muscle and strength. The other thing is that, and I want to turn it over to you in a second, but this is obviously something that I'm very passionate about as well. As I just hit 50 and I have kids, and I want to, what's my goal? My goal is to go out there and be physically active and engage in whatever. A pickup game of basketball. I know you like basketball, actually. A pickup game of basketball, not with my kids, with my 15-year-old grandkids. And I don't even have, my kids are not, they're still young. 2 teenage daughters, the oldest, right? So that's my goal. So I'm training for that, right? So it's quality of life is lower the risk of disease and all these aging diseases. Here's the other benefit, and I'm probably preaching to the choir, but this is for our audience. Having muscle is it's like having too much money in your bank account when there's a recession. It's not a problem. It's a good thing, right? You have all this. This is the same thing. If you do need, I never say, well, if you do this, you'll never get X, Y, and Z. No, you may need a surgical procedure, but you want to have a lot of muscle in case you need to be bedridden for several days, weeks, and have that reserve analogous to having enough money when there's a recession in your bank account, because that's going to help you recover quicker. And that's just another, we could go on and on with the benefits. So the question to you is, am I totally off here? And if I am, you could just look. I'm not interested in being right. I'm always interested in getting it right. So you let me know if I'm off with this notion of longevity and and my fear with sarcopenia. And number two is, if that's the case, then what do we do and how do we train to have more muscle and strength? Yeah. Take it away.
Well, first of all, I couldn't agree with you more, and very well said. Seriously. When I was at Penn State, I had a class called the Biology of Aging. And he wasn't the professor for this class, but he was a professor at Penn State. He was the director of what's called Knoll Physiological Research Lab, which is a world-class research facility on Penn State's campus. And his name is Dr. Bill Evans, and he's widely considered one of the premier researchers in the world on fitness and aging and nutrition and aging. And he did some landmark studies, one back in 1985 and one in 1990 that I like to reference all the time, where they were the first high-intensity strength training studies on nursing home patients.
Great. Yeah.
So the first one was only 10 subjects, and I think they ranged in age from, I think they were like 89, 90, and 91 years old, but they were very deconditioned, sarcopenia and, cancer survivors and, all the medical conditions that you would figure, the oldest of old are going to have. And then 5 years later, he did a similar study. But now the subjects ranged in age from like 78 to 95 years old or something like that. And they were only like 2 and 2.5 month studies. Mm-hmm. But jumping to the conclusion, their increase in strength in the first study was 175% in 2 months, and in the second, now it's low baseline, but still that's ridiculous.
Yeah.
And the other one, which was 2.5 months, it was 114%. But more importantly, some of them were ditching their canes, their walkers, their gait speed increased, their ability to climb steps, even something called spontaneous activity increased by 48%. They just wanted to be more active. And so in any case, so it's my way of citing some research to say that absolutely. Now, flash forward to today, and there's all kinds of study on the oldest of old and nursing home patients. And yes, it all comes down to your muscle mass, your strength, and there's so many associated things that are associated with that, such as reducing inflammation, which is such a big culprit with chronic disease and stuff like that. So there's so many things that are tied into the need to have an adequate level of muscle tissue and strength to go along with it.
Would you increase? So in this notion and this goal of keeping as much muscle, growing as much muscle as possible, having as much muscle as possible and strength moving forward, in the last several things that I've posted or whatever, I said, look, strength training is king. Yep. Which one do you think is most important? I don't know. Which one of my 3 kids do I love most? I don't know. But, aerobic, stretching, and yoga, strength training. I always say strength training. You can get cardio from strength training. You cannot do the reverse.
That's right.
Go into that a little bit. What's a good program? If the goal is muscle growth, muscle strength, I'm talking to a scientist, and I know it's not just it's neuromuscular and things. It's, strength is more of actually activating the nervous system that stimulates that muscle. I think that's actually a very important distinction. But what do I do? What would my program be in that case as I try to live better with age?
Yeah, the National Strength and Conditioning Association, which is widely considered the worldwide authority on strength and conditioning, they have a position statement, a very thorough position statement on resistance training for older adults. But the truth is, if you look at how they break things down, it really applies across the lifespan. They're just kind of scaling it a little bit more towards older adults. But the gist of it is, and it goes back to what we were talking about in the very beginning of this podcast, everyone should be training across that 6 to 15 repetition range.
6 to 15 reps.
So
if I do reps. 20 reps, is there diminishing returns at that point?
Yes. Yep. So, I wish I could have like a chart here, just to make it for a visual, just to make things easier. But generally, if people can picture a continuum, and on that continuum, at the heavy end with 1 to 4 repetitions is that's the heaviest weight you can lift. So it's known as the very heavy repetition range or loading zone.
Oh, 1 rep max.
Yes, so 1 to 4. Yes, one rep max is the heaviest weight you can lift, and the 1 to 4
rep. You cannot do 2 reps.
You can't do 2 reps. Yep.
Okay.
So the 1 to 4 repetition range is known on a continuum is known as very heavy weights because it's the heaviest weight you can lift because you can only lift it 1 to 4 times. The 4 to 8 repetition range is known as heavyweight. You can lift it more than 1 to 4, but it's still considered heavyweight. The 8 to 12 repetition range is known as moderate weight. 12 to 15 is light, and 15 to 20 is very light. And I'm using that as a point of reference because there's not a whole lot of difference between lifting light weights, 12 to 15, and very light, 15 to 20. Like, in other words, why lift very light weights, 15 to 20 repetitions per set, when you're going to get the same benefits and actually even more lifting light weights in the 12 to 15? So
a minimal effective dose.
That's exactly right.
Right. So what's the least I can do to get, and actually Jeff, this is good, right? Because what I'm suggesting is I don't care that you don't like to do weights. Do it anyway.
Yes.
But I want to be I could be in the gym for an hour, actually, because to me it's partly meditation is active. So, but just because I like that doesn't mean you like that, or I should force you to like that. Yep. So I want to know for that group that, look, I hate the gym. What's the minimal I could do to get maximum results? Yeah. So what you're saying is hang around somewhere between what's the right amount of reps?
Yes. So,
and I know it's beyond reps. We could get into that.
Yeah. So starting with that 6 to 15 repetition spectrum that people should train across.
Right.
And just making a point or two on that real quick before we get into the reps. Well, actually, no, we are going to be talking about reps. So similar to that study I was involved in back at Penn State, you ideally you want to stay. Okay. So let's say all the listeners are now want to be my client but none of them, either want a resistance train or they're hesitant or whatever. What I do in my initial consultation is I just tell people the truth. And I say, I feel like it's my job to give you the perfect world situation, and then we'll work with you on how to, but I feel like it's my job to give you the perfect ideal situation, and then we'll work with you on that. And I like to break programming down into 2 categories. Category number 1 is called a familiarization phase. So for people who aren't used to it, we got to become familiar. We got to become familiar with proper form and names of exercises and how the session should flow and things like that. That phase really only needs to last like maybe 2 or 3 weeks. It's a short starter phase, and then we get
like
into
dating. It's like dating. First couple of weeks, before we are like in a real relationship, let's get to know each other a little bit, then we could take it to the next step.
And for those of your listeners who have ever been in physical therapy, that phase actually very closely mirrors what goes on in physical therapy in the sense that it's like 2 or 3 sets of 10 repetitions. It's kind of low intensity, et cetera. And it's just a nice, comfortable start point. So in any case, you're only there for 2 or 3 weeks. Part of it, though, is to get the person to realize, oh, I'm feeling better. And, even with this lower intensity and lower volume, and I'm only doing this like twice a week, I'm feeling better. And so it's part of to get them to kind of trust the system and, and all that stuff. And then you start moving across that 6 to 15 repetition range, but you do it in like reverse order. So we would start at that 10 repetitions for about 3 weeks in that familiarization phase. But then I would place everybody at that 12 to 15 repetition range, stay there for about a 3 to 4 week phase. During that phase, I'm going to get you stronger in each exercise that we're doing at 12 to 15 repetitions. So at that repetition range, I'm going to get you stronger with each exercise that we're doing. And that's going to prepare your mind and your body for when we drop to 10 to 12 repetitions within that 6 to 15 spectrum. We drop to 10 to 12. We stay there for a 3 to 4 week phase. We get you a little stronger
10 to 12 repetitions with higher weight.
Yes. Yeah. Because since we're doing 2 less repetitions, by default, we can increase the load a little bit.
Right.
And
so the magic essentially with time is increasing the load, which means increasing the weight that you're lifting. You have to get to that point.
This is a logical, common sense, linear way to progress in strength. You
Yeah.
start with lighter loads and higher repetitions, and you allow your body to adapt and get stronger in each phase for 3 to 4 weeks, and then you drop to 10 to 12. You increase the load, you get a little stronger in there. You start to realize, oh, I'm feeling better, and I can handle these weights. And then you drop to 8 to 10. You do the exact same thing, 3 to 4 week phase.
Does that weight that you do, let's just keep it at 10 to 12 reps, does it get lighter after a certain? In other words, does it feel like you could do at some point you could do 7 more after you do that 12th rep, and then so that is that an indicator that you need to increase the weight?
Well, yeah. So that gets into it depends on how deep you want to get into this, but I'll kind of give the short answer first, and if you want to get a little deeper,
I guess you could get as deep as you need to. What I want to know is, how do I know that I'm getting stronger? And how do I know that now I need to increase the weight? Is there something that my body's telling me as I lift this weight? Yeah, this feels a whole lot lighter than last week now.
Yes.
Same weight.
Yep. Resistance training is an anaerobic activity.
Mm-hmm.
So aerobic obviously means with oxygen, and oxygen is your primary energy source. And anaerobic just means that you're using energy source other than oxygen.
Right.
When a resistance training set, if it's done properly, it should be an anaerobic set. It should be an anaerobic activity. And so the reason why this is critical to understand is because the way to know that you're choosing the right weights and that you really are, it's an anaerobic activity and you're going to progress, is the characteristics that go along with that. So using a sprint is an example of an anaerobic activity. Anaerobic means that you're at or near an all-out effort. Mm-hmm. So using a sprint as an example, if you're on a football field or something like that, and you're sprinting as hard as you can, you're in a race with somebody, you're sprinting as hard as you can. At some point, you're going to slow down because you can't maintain a sprint forever. So power decreases. You're going to slow down. Number one. Number two, at some point, there's going to be a look of strain on your face because you're putting that. You're going all out. So, and these are characteristics of a true working set. So when you're doing your set, this is how it's called I call it the RPE method, right? Your rate of perceived effort, the effort that you perceive you're putting into the set. So let's just pick like a seated row, and let's just pick 10 reps. Mm-hmm. Because the magic question is, to me, for 27 years now, how do I know what weight I should choose? And my answer to everyone is, just like I got to figure it out as a coach, you got to figure it out too. So there's a learning curve. And so you have to, so what I would suggest is choose a load that you intuitively know is too light. Do your 10 repetitions, and you're going to realize that, there was no look of strain on my face. Every repetition moved with the same speed, and I wasn't huffing and puffing at all after the set. You're going to know intuitively it was too light. And then you just start to incrementally start increasing loads until you find that load where at the, once again, in seated row, towards the end of that set, right, that look of strain starting to happen on your face, the movement is starting to slow, and you notice that as soon as the set's over, you're huffing and puffing a little bit. Those are the 3 characteristics of a working set. Look of strain in your face, movement slows, huffing and puffing.
And also, that is what we would refer to as the intensity, right? So that's one way of measuring intensity.
That's right.
That where you don't have a heart rate monitor, because that's not, that doesn't, you don't have, let's say you don't have a coach. You should have a coach, but let's say you don't. One way of determining intensity that is completely subjective, and it's okay. Yep. It's grimace, right? Facial grimace, breathing.
Yeah.
And what was the third?
And the third one is actually the most important.
Yeah.
The velocity or speed of movement needs to slow. If the speed of each repetition was the same as the speed of every repetition that preceded it, so in other words, if your last rep, you were able to move that weight at the same speed as the rep that preceded it, it was a warm-up. And this is what guides your loading. So that's how you know if that speed never moved. Didn't never slow down, and you weren't huffing and puffing. The load was too light, and you need to.
Do we need to know, Jeff? Do we need to know? Would everyone listening who's saying, "All right, I'm all in with strength training. I need to do this. I'm going to do this." Do they all need to figure out what their 1 rep max is and try to do it?
Nope. And that's the cool thing about this RPE method is it kind of negates the need for that. You just start, so again, I just start someone in that 12 to 15 repetition range. And then it's my job as a coach with each exercise to choose the load. And that's part of what the familiarization phase is about. Cause I'm getting familiar with their body just as much as they're getting familiar with doing exercises and stuff like that. So I use that 2 or 3 week period to learn what the correct loads are for each exercise in that repetition range. And then from there, it just starts to get easier because, we learn from experience, right? So the more you experience, the more you're like, oh, okay. And then as we drop to 10 to 12 and 8 to 10 and all that stuff, you start to realize that, I only need to increase a little bit in order to. So a 10 on, we use these number scales, a perception scale.
Yeah.
A 10 on a scale of 1 to 10 is muscle failure. And that's
where you can't lift the weight.
Right. You can't do it anymore. A 9 means you terminated the set knowing that you could have performed 1 to 2 more repetitions.
So a 8, 9, you finished the rep without help.
Yeah, without help. And it takes experience. The newbie isn't gonna. It takes experience. But for instance, let's say someone's never walked into a gym in their entire life, and they don't even know any exercises or anything. And they walk in, and one of the first things they see is someone on a bench press, and they see and someone spotting them, and they see that person going right, and they can even someone who's never been in a gym before could probably figure out that person's. I hope that person behind them is going to help lift them because they're at the end of their set.
Yeah.
So there is some intuition here, So a 10 on a scale of 1 to 10 is your maximum effort, muscle failure. You couldn't have performed another repetition. A 9 means that you were really close to that. But with experience, you start to feel internally, you know what? I probably could have if I had a gun to my head or something like that. Yeah, I probably could have gotten another 1 or 2. An 8 means you could have gotten 2 or 3. A 7 means you could have gotten 3 or 4. That 7 to 10 on a 1 to 10 scale, that's the working set range. So the cool thing about resistance
training, want to go to failure? Is that something
that's what I'm getting to? Yes, that's the cool thing about resistance training is that not only do you not need to train to muscle failure, you actually shouldn't be training maybe on occasion because it's a nice point of reference. But the truth is, you actually don't want to train to muscle failure all the time. So you can get the benefits of training for decades. I'm 57 and I'm still, with certain exercises, I'm still able to increase my strength a little bit.
Sure.
And I hardly ever train to muscle failure. So as long as so an anaerobic activity means you are at or near, so that word near, an all-out effort. So on a scale of 1 to 10, near means 7 to 10. It means you're within about 3 or 4 repetitions of muscle failure. And then a 1 to 6 is a warm-up. That's the warm-up domain where the speed of the movement didn't slow. You didn't really have much of a look of strain on your face at the end of the set, etc. So those are the characteristics of a warm-up.
I love it.
One last thing. You also, within the scope of a week, you don't want to always go light, and you don't always want to go hard. So the way you set up your program is you ebb and flow with intensity. So you have days during the week where you go a little harder and days during the week where you purposely go a little lighter and harder and lighter and harder.
Harder and lighter means in terms of weight and reps, right? So harder, higher weight, lower reps, then lighter, lower weight, higher reps.
It can mean that. I don't want to get too confusing here, but it can mean that. But it can also mean if someone's staying in, for example, in that 10 to 12 repetition range, and they're there for like a 3 or 4 week phase. It just means that in that repetition range, some sessions they're taking exercise closer to muscle failure, like an 8 or a 9 rate of perceived effort, and some sessions they're not taking. They're leaving some more reps in the tank when they complete the set. So it's more like a 6 or a 7 on that 1 to 10 scale. So it can mean how close lighter can mean how close you take yourself to muscle failure, or it can mean like higher reps. It just kind of depends on how you set up your program.
Sure. All right. So we've discussed what intensity looks like. We've discussed the amount of reps. What are the exercises? What are the exercises? What are so there again, feel free to say I'm crazy. I think that, and it's arguable, I know, because I know there's even Squat University out there. I think that deadlifts are the king. And the reason for that is because very difficult to get injured. If it's too much weight, you just drop the weight. It doesn't, fall on your back or anything. You stimulate, as best as I can tell, and I've looked at almost every muscle from your toe to your neck with one movement. Very few exercises are able to do that. And you get cardio from it as well, because anytime you get closer to the ground and come up, that causes your heart to pump a little bit harder. So you get even cardio from that activity. So first question is deadlift what I think it is? And number two is, what are the main exercises to do for strength training and muscle hypertrophy?
Yeah. You can take the topic of, because the topic we're talking about now is obviously is exercise selection or choice of exercise. You can break that topic down into two categories. There are what's called primary exercises. And the cool thing is, from a learning standpoint, there's only so many primary exercises. And so if something doesn't fall into the category of a primary exercise, it's by definition an assistance exercise. So in other words, there's primary exercises and then there's everything else. So primary exercises are, and I'll get to your question in a second, but squats, deadlifts, pulls, presses, lunge. I would argue that lunges can go in there. And some people would say even things like carries. But generally, most people would not argue that squats, deadlifts, multi-directional lunges, pulls, and presses. So those are your primary exercises. So which means that people should revolve their routine around the primary exercises to get the most bang for your buck. When it comes to squats versus deadlifts, I am in the camp that both of those exercises are the king or queen of all exercises. Both of them activate over 200 muscles in the body, and you're going to get benefits from both. Where both of them are going to really get your glutes and, like you said, basically your trunk, so your core, your back. Deadlifts are going to do a better job with the back, probably back musculature. Yeah. But squats are going to hit the quads a little better, and deadlifts are going to hit the back of your hamstrings and the back of your thighs a little better. So I would just say that let's insert both. So I will argue with you a little bit there. But with that,
come on, man.
But you hit.
You got to choose one. Here's the other thing with deadlifts. Also, I've been doing those things for a long time, so I love them both. But I'm looking at it from the perspective of the new person in the gym. Which one is less intimidating? Barbell on your back? Again, not so much for me, many of my friends, but new person let's say without a coach, that's intimidating, as opposed to getting in a hex bar, right, or even a barbell and just doing deadlifts. Don't you think?
Yeah. Well, no, I'm gonna. So we're getting ready to get into a yelling match here.
Go ahead, yeah.
So how I go about it I think that both can be intimidating in an it depends situation. Like, for instance, I work clinical, rehab sports medicine setting. So pretty much everyone who's referred to me has some sort of musculoskeletal issue, with low back pain being right up there. And so there's a lot of people who are scared of deadlifts just because of what they heard. All the myths about deadlifts is going to kill your back, and all that stuff. So I think it's kind of, it depends. And the way I go about it is with everybody, and really on every exercise, but we're talking about squats and deads right now. The first thing I do is I underload them, like on purpose. Like I choose weights on purpose that are way too light, and I know they're too light. And I also make sure that I find their what's called available range of motion, their pain-free range of motion. So I really make sure that I'm choosing a range of motion that's going to be easy for them. I'm choosing a load that's going to be easy for them, and I'm choosing a repetition range. We're not going to do 15. We're going to do 6 or 5 or something like that. So I really kind of close that box in to make it just a nice, easy comfort zone type of situation to get their trust and make them realize that this isn't as bad as what you might think or what you might have heard or whatever. When it comes to like bar in the back, what I typically do is start with like something that's insignificant, like an 8-pound body bar or something like that, just to show them that even though there's something on your back, you can totally handle this. And then we just go up in small increments, whether it's in the same session or over the course of that 3-week familiarization phase or whatever. So I grade everything, I gradually increase everything. And that's how I go about diminishing fears and gaining trust and confidence in the exercise and me as a coach, and all that stuff. So that's part of the reason why we're getting ready to get into a shouting match with each other because I do think that squats and deadlift.
I'm listen. There might be no 1 and 2, but you know how it is. Who's the best player ever?
Exactly.
Right? So that kind of stuff.
Exactly. Yeah.
All right. So we got the selection of exercises, presses, anything. So shoulder presses and bench presses or chest presses.
So back rows. And then, horizontal, some sort of chest press, whether it's a dumbbell or a bench or a push-up or something like that. So horizontal press. And then overhead press. Since so many people have shoulder issues, I actually don't start with that. I start with more just like lateral raises and reverse flies and, more like not having the arm go above the head at first and kind of strengthen the shoulder, rotator cuff, things like that. So I start with there in that higher repetition range. And as we start to drop down into lower repetition ranges, then I will, depending on if the person has a healthy shoulder or it's gotten healthy because of what we're doing, then yes, I'll start to do overhead stuff. But so squats, deadlifts, lunges, rows for the back, presses for the chest, and shoulders. Depends.
Mm-hmm. What's the rest period between one set and the next?
So the way I start with pretty much everyone in that 3-week familiarization phase is I allow their heart and breathing rate to come back to at or near resting level. So in other words, I don't time. I just allow it to come back to at or near resting level, and I make sure that they're mentally ready to perform the next set. But as their fitness level increases, then I do start to, like, for instance, I'll superset. So we'll, for example, go do a leg exercise and then a back exercise. So we'll go back and forth. That way their heart rate's staying up, but their legs are recovering while they're doing their back. So it's just kind of a way to, right. And so I'm not really timing rest periods. I'm allowing the supersets to time the rest period. And so we'll go from a leg. So we just finished a leg exercise. You're a little winded from it. We go over to the seated row machine or something like that. And I'll basically say, I don't want your heart rate to come completely down to resting level, but you don't have to like go right away, and then do your set. And then when we go back to do legs again, I actually will allow their rest to come back to resting level. Everything operates on a continuum, so kind of my point here is in the beginning, I allow a lot of rest. As their fitness level increases, I start to reduce the rest a little bit. And as we go, as their fitness level is really increasing and they've been doing this for months or years or whatever, then the answer to your question is it depends on the repetition range. Higher repetitions with lighter weights means less rest periods between sets. Lower repetitions with heavier weights, you're now working on strength and you don't want to be fatigued from set to set. You do want to rest. You do want your heart and your breathing rate to come back to resting level.
5 minutes, 3 minutes?
Yeah. So the gist of it is, it's repetition range dependent. So the 1 to 4 repetition range, generally speaking, is 5 to 7 minutes. The 4 to 8 repetition range, generally speaking, is 3 to 5 minutes. The 8 to 12 repetition range, generally speaking, is about 1 to 2 minutes or 1 to 2.5 minutes. And then 12 and above, you can do you really would never want to go much below 45 seconds or 60 seconds because you do need some recovery.
Sure.
But 45 to 90 seconds in those higher repetition range.
All right. So minimally effective dose. We have how to tell intensity, amount of reps, rest period. How many sets should we do?
Yep. So in that familiarization phase, I look at sets actually first as your weekly sets. And then you just do the math and you break that down to what does that mean in the scope of a session.
I see.
So we want to strengthen each major muscle group in our body, like our legs, back, chest, shoulders, for example, at least twice a week. So let's 2 to 3 times a week, but let's say.
So how many weekly sets do we want to do for each muscle group?
So in beginning, for people who are just starting, we don't want the volume to be too high or they're going to be sore and cursing your name, not be able to walk or whatever. So the weekly set should be 4 to 6 at first that 3-week familiarization phase, which equates to 2 to 3 sets per session. Right? Because most people are training like twice a week to start anyways. So that's 2 or 3 sets per session. But now getting really to your main answer to your question, current research is showing that the minimal effective dose, if your goal is to increase your muscle size, it's actually a spectrum. Everything operates on a continuum. So it's 10 to 20 sets per major muscle group per week. If your goal is strength, you actually don't have to do quite as much. It's more like 8 to 15. So then you got to, so there's your
12
point of reference.
sets. If you do 12 sets a week, you're getting a decent amount of both. That's what it sounds like, right? Exactly. You're getting good amount of both if you do about 12 sets. Yep. So what if I'm doing deadlifts several times? So I'm doing deadlifts one day in 1 week, and then I do squats. You're hitting several. Does that, so those 4 sets of my deadlifts, is that for every muscle group that I care about since it kind of stimulates, or is it not as specific?
It's not as specific because even though your back is contracting really hard during a deadlift, it's an isometric contraction. So it's, the back muscles aren't really, they're stabilizing and they're contracting really hard and stabilizing, but they aren't causing movement in the upper body to occur. So that's the reason why you want to include your rows and your presses. So along with your squats and your deadlifts. So I don't know if that answers the question.
No, it does. Look, it I think that you've done a great job. And look, we're trying to get to the prescription of the exercise, right? So within that comes some complexities, of course. Absolutely. So we're trying to narrow it down for those that are at, I've never exercised before in my life, and God, I have to do strength training. I heard the Dr. Gio podcast, and Jeff Young, I have to do the strength training thing. I don't want to do it. For those that are exercise people but not strength people, and even those that are already strength people, how to optimize their program for them to live longer and better with age and prevent or lower the risk of diseases or even co-manage it. So we're trying to hit many things here. So it's a little complex, but I think there's a lot of takeaway. Jeff, thanks so much, man. I really appreciate you coming on. How can people be in touch with you or anything that you have to offer?
Email me if you have questions. So it's JY and then kinesiology. So it's KINESIOLOGY. So it's JY kinesiology, one word, @gmail.com. Follow me on Facebook.
Very good.
Provide the link would be great because that really is my number one. I'm on Twitter a little bit. I'm on IG a little bit, but I'm mostly a Facebook guy. Mm-hmm. For some listeners, that might be.
You're clearly over 50 years old, as I am.
Right, exactly. And then there's a website that I launched with a physical therapist colleague of mine, which unfortunately, it was started off as like a content dump, but I'm getting ready to, one of my goals here very early 2023 is to work with a web designer and clean it up. But it's mrfinstitute.org, not .com.org. So MRF stands for Medicine Rehab Fitness. So it's the Medicine Rehab Fitness Continuum, mrfinstitute.org. We're going to be cleaning that up a lot over the next several months. And there's a lot of educational content, proper form videos. I have a book and instructional videos and stuff like that people can check out if they want.
And what's your Facebook handle again so that people can follow you there?
Yep. JY Kines. So JYKINES. So that's my social media handle for Instagram, for Twitter, and for Facebook, JY Kines.
Excellent. Thanks so much, Jeff. We'll link this up in our show notes. Thanks so much.
Thanks for having me.
Have a great day. Thank you.
Same to you. Really appreciate it.